A stone tool scrapes against bone, sparks of pain exploding in the skull of a man lying motionless on the ground. His head has been bound, his hair shaved away, and with slow determination, the healer carves a perfect circle into his skull. The onlookers whisper prayers, believing that, with every flake of bone removed, an evil spirit is being driven out. The procedure is trepanation, the ancient practice of drilling into the human head, and against all odds. Many patients survived this gruesome operation. Trepanation is one of the oldest known surgical practices, with evidence dating back at least 7,000 years. Archaeologists have unearthed skulls from the Stone Age bearing circular holes deliberately cut into the bone. These are not the marks of violence, but of surgery, carefully placed openings where the bone shows signs of regrowth, meaning the patients lived for months or even years after the operation. Far from an isolated ritual, trepanation appears across continents. In Neolithic Europe, in pre-Columbian South America, in ancient China, and even in Africa. The persistence of this practice suggests a universal human attempt to combat conditions that baffled early societies. Why would anyone submit to such a terrifying ordeal? In a world without antibiotics, anesthesia, or modern medicine, trepanation might seem like a death sentence. Yet ancient peoples believed the skull housed more than just the brain. It was the battlefield of spirits, demons, and unseen forces. A sudden seizure, a crushing headache, or a bout of madness could be interpreted as possession or a curse. Opening a hole in the skull, then, was not only a medical act, but a spiritual one, a doorway to let the evil escape. The methods were shockingly crude, yet remarkably effective. In Europe, flint tools or obsidian blades scraped or drilled into the skull. In South America, particularly among the Incas, sharper instruments of bronze or stone were used to carve squares and circles with surprising precision. Skulls discovered in Peru show that trepanation was performed extensively, sometimes with multiple holes in the same head, and survival rates were astonishingly high, far better than those of battlefield surgeries during the American Civil War millennia later. The Incas, it seems, had mastered techniques of keeping wounds clean and avoiding fatal infections long before modern science. But trepanation wasn't always about spirits. There is evidence that it was used to treat real medical conditions, particularly head trauma. Warriors struck in battle often suffered fractures or bleeding within the skull. And trepanation may have been used to relieve pressure, allowing the brain to heal. In some cases, the surgery was likely life-saving. Even today, neurosurgeons perform a similar procedure, called a craniotomy, to reduce swelling after severe brain injury. In this sense, trepanation was not entirely superstition. It was an early form of brain surgery, discovered through trial, error, and desperation. Cultural meanings, however, varied. In some societies, trepan skulls may have been worn as amulets, proof that the individual had endured a sacred ritual. In others, the act was tied to shamanistic practices, marking the patient as someone who had crossed the boundary between life and death. Among the Greeks, Hippocrates himself described trepanation as a way to treat head injuries, showing that the practice had already bridged the line between mystical belief and medical reasoning. Yet for all its longevity, trepanation was also a source of fear and fascination. Imagine the sight. No sterile operating room, no anesthetic. Just a sharp rock and steady hands scraping into living bone while the patient, awake and conscious, endured unimaginable pain. The fact that people willingly underwent this ordeal speaks to both the desperation of illness and the powerful belief in unseen forces. Where modern science seeks causes in biology, our ancestors sought them in spirits, and trepanation was their way of restoring balance. The practice continued into surprisingly recent history. In parts of Africa, trepanation was still being performed in the 19th and even early 20th centuries, sometimes with iron tools but using the same scraping techniques of prehistory. Accounts describe healers who performed the surgery with astonishing skill, and survivors who bore the scars as marks of resilience. Even in modern times, trepanation has not completely vanished. In the 1960s and 70s, fringe groups revived the idea, claiming that drilling into the skull could expand consciousness, enhance creativity, or restore vitality. Though dismissed by science, the persistence of the idea shows how deeply the allure of trepanation lingers. Today, The practice stands as a reminder of both human ingenuity and human desperation. It reveals a time when the mysteries of the mind were so frightening that people turned to the most extreme measures to find relief. Astonishingly, many lived to tell the tale, their bones healing around the hole as proof of survival. The ancient patients of trepanation force us to reconsider what we think of as primitive, because in their crude surgeries lie the earliest beginnings of neuroscience. From Stone Age shamans to Incan surgeons, from mystical ritual to crude medicine, trepanation is the story of humanity's battle against the unknown inside the skull. It is a tale of pain, courage, and survival. A chilling reminder that the line between superstition and science has always been thinner than we like to believe.